Welcome to this edition of Labor Vision. I'm Bob Delaney, Executive Director of the Institute for Labor Studies and Research. Labor Vision, a production of the Institute, focuses on topics of importance to working Rhode Islanders. We hope you enjoy this edition.
Thank you so much for watching. You're watching Labor Vision, the at-home edition. I'm your host, Erica Hammond, and join with me today from SEIU 1199 New England is Emmanuel Falk. Thank you so much for joining us, Emmanuel.
Thanks for having me on again.
Yeah, welcome back. I think last time you were on for the Mardi Gras special edition, right?
Right.
So
things changed quite a bit since then.
Yes, significantly. For all of you who are watching, if this is your first time watching Labor Vision with Emmanuel on, SEIU 1199 New England represents the nurses, CNAs, technicians, clerical employees, service and maintenance employees, as well as childcare providers at a number of locations, hospitals, nursing homes, etc. And I can imagine, I know that this is kind of a really crazy and busy time for you and your members right now, Emmanuel. So if you just want to talk a little bit about the impact that this crisis has had on working conditions and your members specifically?
Mm-hmm. Yeah. So I know the last time we were on, I talked about a years-long staffing crisis in nursing homes. The nursing home industry in Rhode Island and throughout the country, basically has built a foundation, a flawed foundation of a system that underpays workers. They're underpaid because they're women, and they're primarily women of color. Ever since there's been nursing homes, they've been underpaid and mistreated. And for the last several years, the nursing home industry in Rhode Island and nationally has made a lot of profit off not hiring enough people, not having enough staffing, and by underpaying folks. And what that has led to in this moment is we went into a pandemic with an existing staffing crisis. It's just heart aching. Obviously, a lot of workers, our members, have gotten sick, haven't been able to work. So the pool of staff to be drawn upon is less, and now there's even less people in the nursing home doing the work because they're getting sick, and they're all the residents have, but the residents are, the ratio is, in some cases, we've heard of, 3 or 2 staff taking care of 60 to 70 residents on a shift. So this all could have been a lot less bad. And the problem with the nursing home industry, historically underpaying folks, is it forced these dedicated workers to work at multiple jobs, which in the time of the pandemic has, accelerated the spread, unfortunately. If we, had a principle where, you work full time and one job was enough, the situation wouldn't be as bad. I don't want to say that there wouldn't be issues, but it's very heart aching. Obviously, your members are really afraid. They're dealing with residents who are afraid, and they're really, struggling to complete each shift each day. In Rhode Island, knock on wood, we have not lost a member yet to the pandemic, but our local in Connecticut has lost 12 members already. So it's a really bad situation, and now more than ever, it's highlighting the fact that we really need to do something about staffing and build a long-term care system, a nursing home system that honors the work that these workers are doing. It's great. Everyone is finally realizing that these workers are heroes. They always have been. But these workers, they need policy that helps them, that improves their lives, not just the rhetoric that they're heroes. Heroes need public policy this year, and that's what we're still fighting for at the General Assembly, to get safe staffing in our nursing homes.
And that work that you're doing around safe staffing, that's the Raise the Bar campaign, right?
Correct. So the Raise the Bar campaign, which we're a part of, it's a coalition of community groups, faith groups, individuals, and us that have been, launched in the summer of 2019 and have been pushing for a 4.1 hour minimum staffing standard, meaning residents get at least 4.1 hours of care per day that they're in a nursing home. That's the federal guideline. Rhode Island is one of only 11 states that has no minimum staffing standard. And according to CMS data, which is the Center for Medicaid and Medicare Services, the federal government entity that does Medicaid reimbursement for nursing homes, according to the last batch of data they have, we rank 42nd in the country in terms of the average number of hours of care. And that was unacceptable before the pandemic, and now it's been completely exacerbated when we think at times close to a third to a quarter of the staff are not able to work because either they've gotten sick at work or they've been exposed to someone at work that is sick. So we really need to do something. We can't just call them heroes. We got to treat them like heroes, and that means passing policy this year. Nursing home workers have been saying it for years that the staffing is not good. Now that we're recognizing that they're heroes as a society, we should listen to them and make real change.
Absolutely. And in response to a lot of this that's been even more compounded with the crisis, what are some of the ways that SEIU is kind of raising awareness, showing support for their members right now?
Our members have done an amazing job. They continue to show up to work. They complete their shifts. Their shifts are longer now. They're under greater demands because obviously residents are getting family. A lot of them are working in units that have some COVID cases. So the demands on their time, like they have to get, when you have COVID, you get more thirsty and you need to stay hydrated. So now, you know, on top of everything that the workers do every day, they have to make sure that residents that have COVID are well hydrated, and those that don't have it need to stay well hydrated in case that they do get exposed to it. So I can't even describe it, like in what they're going through right now and how hard it is to go through each shift. It's exhausting, but despite that, they're fighting, and you know, through their union, they've fought for hazard pay. We've done a series of car caravans, and you know, we're happy to report in some places like Charlesgate, workers won a $10 an hour hazard pay, which is significant. And in every facility, every nursing facility, workers have won hazard pay ranging from $4 to $10. So that's been good. It's still not enough money, but at least there's some reward. And I want to be very clear: the nursing home industry, the bosses, they didn't offer this. They didn't say, "Oh, you know, in this tough time, we're going to do this." It had to be fought for. It took workers at the work site fighting. It took allies and caravans. I know you came to one of them to really bring attention to this and shame and demand and fight for the hazard pay. So I want to be very clear: workers won this. It wasn't done out of the goodness of the administrator's heart. We're happy to have a system for the last several decades that was profitable and underpaid workers.
How can community members, I know you mentioned that allies turned out, that was a great turnout too. The caravan that I went to was really awesome. There's a lot of cars there. How can community members get involved in these or hear more about this and figure out ways that they can get demand these same things for the members?
So it's really easy to help out on this campaign. Obviously, we need to get the legislation passed, the Nursing Safe Staffing and Quality Care Act, introduced by Representative Slater in the House and Whip Senator Goodwin in the Senate. It's really easy. Folks can, if we can put a link at the bottom, we'll put a link that folks can go, and it will allow you to directly call your legislator. You will click on the link, you'll get a phone call, and then you'll automatically be connected to your rep and senator. And it's really important that they hear from us on this, that that they cannot leave the General Assembly this year without doing something on this issue. You know, I think as of last week, we had the most percentage of resident deaths in nursing homes in the country. They cannot leave without addressing policy, and they need to hear that from their constituents. So we've created a really cool tool. It'll be on the bottom of the screen, I guess, and you can just click on it. And again, it takes about a minute, and it automatically connects you. It takes all the guesswork out of it. There's a little script if you don't know exactly what to say. And then the other thing you can do is just continue to email their rep and senator on this issue as well.
And what is the Facebook, your SEIU 1199 New England, is that the name of the Facebook page too, if folks want to look at some of the posts?
The best place for folks to go is the Raise the Bar Coalition Facebook page.
Okay.
It's Raise the Bar on Resident Care in Rhode Island.
Okay, awesome. And I just want to turn the floor over to you if you would like to add anything before we close. Anything?
No, I think, you know, everyone has you know, the world has changed. I think there's an opportunity to at least make some improvements, you know, as we navigate through this pandemic, and hopefully through pressuring our elected leaders, we can begin to build a system that works better for the elderly and for the workers that take care of them.
Absolutely. Well, thank you so much, Emmanuel. I know that you guys are so busy, so I thank you so much for taking the time to be on here and share all this information.
All right, thank you, Erica, and thanks for, you know, supporting our members at a couple of the caravans so far.
Absolutely. Stay safe.
All right, take care. Bye.
All right. For those of you who are watching from home, you're watching Labor Vision, the at-home edition. Thank you so much for tuning in. We hope to see you back here soon. Have a great night.
Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments. Labor Vision can be seen on this channel 3 times each week: Tuesday at 7 p.m., Thursday at 8 p.m., and Saturday at 5 p.m.